In this video, I'm going to walk through the new Paired Health Referral Portal. The new referral forms are much leaner and are able to be completed much quicker, enabling you to submit a patient referral for a home visit in a matter of just seconds. Remember, to access this referral portal, you simply have to go to your web browser and type in the URL that has been assigned to your particular health system or provider group. Once directed to the new referral page, you can see that the fields required for submitting a referral are all shown on this single page. All fields marked by a red bar are required fields that must be populated in order to complete the referral. The first field required for submitting a service request is the patient MRN. Providing the MRN allows the provider conducting the home visit to have access to the detailed patient information in the electronic record. Next, enter the patient's first name and patient's last name, the preferred phone number for contacting the patient. This can be the patient caregiver's phone number if that's the best way to get into contact with this particular patient for home visit scheduling and confirmation and follow-up calls. Next, the patient home zip code or the zip code of the home location where these visits are anticipated to take place. Note that if the patient address is outside of the defined service range, you will receive a notification at the top of the page telling you that this particular patient is not within the normal service area and may or may not be accepted to the program for a home visit, depending on the specifics of this particular request. The services requested field here is a free text field for any detail regarding the reason for requesting a home visit with this patient. In this example, we'll just say that we're requesting an in-home follow-up with this patient as they are being discharged on Coumadin and have multiple 30-day readmissions within the last 12 months. Here in the additional field section, depending on the health system or provider group that you're referring from, there may be an additional field for completion. These fields are not required for submitting referrals, hence there is no red bar beside the field, but should be included as the information is readily available. For example, for WakeMed Health System referrals, please indicate the expected date of discharge for inpatient transitional care referrals and whether the patient does not have a PCP and requires the PCP coordination services. For Wake Forest Baptist Health System referrals, you should also include the expected date of discharge for transitional care referrals, in addition to selecting the patient's home health status at the point of discharge as it's known. So selecting from the following options of home health ordered, patient is active with home health, or indicate if the patient has refused home health. For Wake Key Community Care referrals, you have the option to select the number of days in which you are requesting that this patient receive a home visit. Please be mindful that this date is a request and will be met as provider capacity and availability allows. In the About You section, enter your name and contact information so that you can be kept in the loop for this service request, as well as be the point of contact for the provider if any questions arise regarding this patient. Finally, as a security measure, you will be asked to enter the letter and/or numbers shown in the CAPTCHA image at the bottom of the page here. If you are submitting a transitional care or ED follow-up request, simply click Submit and the referral is complete at this point, as indicated at the top of the page. For all accounts where Paired Health does not have access to the patient electronic records, for example, Wake Key Community Care referrals, you will be prompted to attach the patient's latest discharge summary regardless of hospital, as well as the last 3 office visits conducted with the patient. Simply attach a PDF version here and add attachment here to complete your service request. Again, as before, you can verify that the service request has been submitted at the top of the page. For all referrals, regardless of type of request or referring health system or provider group, you will also receive an automated email notification confirming that the service request has been received, and another email notification once the patient has been accepted and will receive a home visit, or that the patient has been rejected based on established clinical or geographic parameters. As you just observed, I was able to submit this patient's service request for a home visit very quickly and easily. If you have any technical questions regarding this process, please submit an email to support@pairedhealth.com.